Hi. So in this lesson, we will review dating, how surgery will affect your spouse, parenting and pregnancy, and your relationship to other family members. Now, let's discuss dating time. Dating can be scary. Now, as you lose weight, you will become more confident, and confidence by itself can be very attractive. On the other hand, you might have concerns about the excess skin if you haven't had plastic surgery yet. Now, just remember, no one's body is perfect. You have lost so much weight and you should be proud of your accomplishment. That being said, how much and how soon you share about surgery is a personal decision. If you want to keep your surgery private, I suggest not going out to eat on your first date. If you're nibbling on a small salad, your date will probably notice. Suggest another activity like going to a movie or a concert. Now for your significant other. Weight loss surgery can make good relationships even better. You will have more energy, you can be more active with your spouse, and truly enjoy going out. Life with your partner might be better than ever. Now for the bad news. The hormonal changes after surgery might make you very emotional and lash out at anyone without a reason. Also, it takes a very secure spouse to feel proud if you're openly admired after your weight loss. Some people might make comments like, "Hey, your other half looks great, you better watch out." Those kinds of comments never help. Bear in mind that weight loss surgery makes good marriages better and can make bad marriages worse. Some studies suggest that the incidence of divorce among weight loss surgery patients is higher than the average. The best thing you can do to protect your relationship with your significant other is to involve them in your plans for surgery, ask them to join the support groups meeting so they can meet other spouses, and always reassure them of your love. During weight loss surgery, you need your spouse's support and they need yours too. Let's talk about your kids. Depending on their ages, your kids might not grasp the importance of long-term health, so they might not understand why you're putting yourself through surgery. And it's actually a great lesson for your kids to see the value of taking risks to improve your life. Share with your kids that you're having the surgery so you can play with them more than you could before the surgery. You will be able to go on roller coasters and other amusement park rides with them, and you will take walks and ride bikes together. Don't forget, enjoying life more with your kids or even grandkids is a great goal to have after surgery. If going out to eat was a common activity with your children, as your eating habits change, it's important to make time to go on other adventures together instead. And when it comes to pregnancy, it's important to know that many women have increased fertility and can become pregnant when they've never been able to conceive in the past. That said, it's critical to avoid getting pregnant the first year after surgery because you're losing weight so fast. However, the bonus of waiting, once you're beyond the first year and a half, you will have a lower risk of pregnancy because you're carrying less weight, your blood pressure is lower, you are on fewer medications, and your overall health is better. Now, when it comes to your family members, some might support you and some might not. Focus your time and attention on those who do offer the support you need, and your other family members will hopefully come around in time. Always remember that genetics play a very important role in obesity. So some of your relatives might need weight loss surgery, but opt not to have it for different reasons. Any remarks you hear from them are less about you and more about how they feel about themselves. Okay, that was a lot to take in. You're doing great. When you're ready, I'll join you in the following video.